To retention! To retention!
Do we have anyone here from the North Battleford area, Lloydminster area? Do we have people here from the Prince Albert area? Anyone here from Regina? Anyone here from Weyburn, Estevan, Gainsborough area? Do we have anyone here from the Yorkton campsite? Thank you so much for all of you for being here today. I just want to thank a special thanks to our sister unions, our SFR president, and I also want to say a special thanks to our former president, Sandra Sai. She's always here, even though we don't invite her. She's always been here. You know, sometimes we are so busy, you don't send her invitation, but I just want to acknowledge her for her great work she did before here. So while we are here today, this is going to be the most informal rally because the press here are tired of hearing from me or from Linda Renkes or any one of us. We are here today, we brought our members today so you can hear directly from our members, but we will start by kicking off by hearing from our SFR President, Laurie Jobe, to give a 1 or 2 minutes.
Thank you so much, Bashir, and thank you to all of you for being out here today. Beautiful Saskatchewan day and a perfect day for a rally. And I also heard somebody say back there, Happy Fair Deal. Let's try that again. Happy Fair Deal Day. Because I think today's the day. Let's let them hear it in there. Healthcare workers have been out in the cold far too long. It's been too long. We need some respect, and we need more than anything, we need a fair deal. Yeah, and today is the day. Let's hear it. And I'm with Bashir. We need to hear from the people that do the jobs every single day, and I'm excited to be here. Thank you so much for inviting the SFL to be part of your rally.
Thank you so much, Laurie. And just for folks, for you to know, we extended an invitation to both the government. I had an opportunity this morning to talk to the Minister of Health. We extended an invitation to him. We extended an invitation to the opposition. So folks are here with us today. So next, I want to go to Michelle and Lorne. They are LPN from the Yorkton District Nursing Home to hear directly from them.
Good afternoon, I'm Michelle. I am from Region 5. I have been an LPN for 26 years and I was a CCA 5 years prior to that. I have never thought that I would have to or need to have 2 nursing jobs in 2 provinces to ensure my family survives. We are nurses, LPNs, we are CUPE, we are one. We are trained to work full scope, to think critically, advocate, educate, care, and instead we are being punished or pushed into survival mode nursing. Keep people safe, get through the shift, come back and do it again. That gap between what nursing should be and what we are able to deliver is exactly what drives burnout and moral injury. A lot of CUPE members feel like we are failing our patients, when in reality, the system is failing all of us. Let me be clear. When workers are ignored, when staffing is unsafe, when wages don't keep up with the cost of living, that doesn't just hurt us, it hurts families, it hurts communities, it weakens the very system people rely on every single day. But today is not just about what we're against, it's about what we stand for. We stand for fairness, we stand for respect, we stand for safe working conditions, we stand for a future where workers are valued, not just in words, but in action.
Good afternoon, my name is Lonnie. I am an LPN working in long-term care in Region 5, Yorkton. I am proud today to be able to speak on behalf of my union members. Licensed practical nurses in this province are working harder than ever to provide safe, timely, full-scope primary nursing care. Like many of our fellow CUPE members, we too are denied vacation, we are short-staffed, the workload has increased, and many of us are having to work more hours to provide for our families. We are doing more in our jobs than it seems like for less pay. It is hard to feel valued in healthcare when we have not seen a decent raise in several years. Yet our Shame, yeah. Yet our scope of practice keeps increasing as well as the cost of living. On top of all of that, the government, or should I say maybe the employer, wants us to be utilized at multi-site facilities and jurisdictions at will. Is this really at the best interest of patient safety? What about continuity of care? Not to mention, caregivers of this province are already working more, have families, are homeless. Don't you see multi-site work is really not family-centered care for our employees? In order to take care of the people of the province, you need to care for the frontline team. You cannot pour from an empty cup into healthcare. Your frontline workers are burnt out. We are tired, and we are too. And we too want to care for the people of this province. However, we need a healthy family, work-life balance, a living wage, and a safe work environment. We have waited long enough to be recognized. This government cannot afford to lose any LPNs, care aides, techs, and other support staff to other provinces who are offering higher wages and better incentives. The CUPE members are here today to send a clear message, and this has not changed. We are still fighting for safe workplaces, fair wages, and respect. We will still push back against decisions made without us, even though we are the ones who keep everything running. To the CUPE members in this province, look around you. You are not alone. Together, I want you to know you are powerful. Together, we can create change. Let your voices be heard. Let's stand proud in who we are and what we do. Let's stand firm in what we deserve. And let's stand united for our union, our patients, the people we serve, and our future. I am Lonnie. I am an LPN. I am CUPE. We are CUPE. Look around. This is solidarity. And we will not settle for less.
Thank you so much, Michelle and Lonnie. Now we want to go to Erin, an LPN from Meadow Lake. Is Erin around?
We're good.
Careful, slippery.
Okay, hi, my name's Erin. I'm an LPN in Meadow Lake. I have been nursing for about 10 years. We work tirelessly every day. We wear multiple hats. We do multiple jobs. We all work in multiple positions. We're all tired. We're all short-staffed. I feel like I advocate for my patients every day, and I also want to advocate for CUPE 5430. So that is why I'm here. I have my co-nurse, and now very good friend Cindy as well. We stand and we want support. We want to be united. We want everybody to be deserved of what we're worth.
We want fair wages. We want a settlement. We want solidarity. We're here to support everybody, but we want fair wages, and we want to stay at home.
Thank you so much, Cindy. Thank you so much, Erin. Now, next we will go to Jean. Jean is a maintenance worker at the Regina General Hospital. Where is Jean? All right, good.
Hi, my name is Gene. I've been a healthcare worker in Regina as a facility maintenance operator for 11 years. In those years, I've seen departments consistently working short-staffed, being denied holidays, and working OT is the norm. This is bad for the workers, bad for the patients, and the services we provide. Good people are leaving because working conditions are terrible, and we're struggling to make ends meet. Who would want to work in a healthcare system that denies us a raise for 4 years? This government needs to recognize that healthcare workers are on the brink and need respect and a fair deal. They don't care about us. We are just a number to them. I think this is absolutely disgusting, and they should be ashamed of themselves.
Thank you so much, Jean. Next, we will go to Brenda Shaw from the Weyburn area.
Good afternoon. My name is Brenda. I have been a healthcare worker for 28 years. But today I want to share a story that speaks to what's really happening in our healthcare system right now. One of our colleagues should be standing here with us today. She wanted to be here. She cares deeply about her patients, her coworkers, and the work she does every day. But she's not here. Actually, she is in BC right now at a job interview. And that should concern, yes, and that should concern every one of us. Because this isn't about one person. This is about a system that is pushing people out. So since Leash can't be here, I will read her words for her. And just so you know, Leash is a CLXT in an acute care center and has been doing this for 10 years. And what she says is, if people need to work between facilities, we would lose staff. Many have obligations and families that they can't work 45 minutes plus away, and expecting them to do it is disgusting. Also, then there would be a lack of training, lack of knowledge, of expectations, increased mistakes, and cause a huge fault in patient care. Every site may have different machines, policies, etc., and staff have the right to refuse unsafe work, even if it's unsafe for the patients. A tech that has only worked microbiology for 15 years and then being tossed into transfusions at a different facility without training is a huge patient hazard. And the on-call demand is insane to go up to 260 days. That's not sustainable. People will burn out, especially with how the call is. Stress leave will increase, and people will leave the medical field for the lack of pay and the abuse of our system. We are being asked to travel between facilities, sometimes 45 minutes or more away, while still be expected to provide safe, consistent patient care. We're being placed into unfamiliar environments with different equipment, different policies, and often without proper training. That's not safe for workers, and it's not safe for patients. We are seeing increased stress, burnout, and people leaving the profession entirely. Not because they don't care, but because they can't keep doing this. We have families, we have responsibilities, and we deserve to work in a system that supports us, not one that stretches us so thin that we break. Safe patient care requires stable, trained staff. It requires respect for the work we do. And it requires action, now, before more of our colleagues walk away. Because today, it's one person at an interview in BC. Tomorrow, could be many more.
My name is Carla Tanchik. I'm from Region 2, and I have been in healthcare for 30 years. I feel very undervalued. I work as a CCA. I've been in long-term care. I go around all over our region, from Canistino to Prince Albert to Big River, back to Hafford to Spiritwood, Leoville, and we hear the same thing. No members feel valued. We are very hurt. This government isn't listening to us. We're short-staffed. We have members phoning other members saying, we're the only one that showed up at work today. Can you please come and assist us on the floor? Please come to work. Using the lifts, you need 2 people. Sometimes we don't have 2 people. So we really need this. We need this government to hear all our members and to give us our fair deal. Thank you.
Thank you so much, Carla. That was a very good one. Before I make my closing remark, I just want to share a story. At the beginning of this bargaining, I went to the Pasqua Hospital in Big River. I met a member who came to me. She said to me, 2 of them, they both, one of them is a unit service worker, one of them is an environmental service worker. they said to me, Bashir, all we want in this round of bargaining, I want to be able to make $20 an hour before I retire. I have been working for 18 years. 18 years, all they want is to make $20 an hour. Many of our members, CUPE members, make less, about $40,000 or less, majority. We are not asking for something out of the ordinary. We only want to be treated fairly. Why am I saying this? Because there is a myth out there that healthcare workers are paid a lot of money. That is not. I can tell you, you can check the classification. The SHA release their report every year. Majority of our members, their name, anyone who makes $50,000 and above, your name is on that list. Majority of our members don't make that list because they make less than $50,000 a year. The theme for this year's budget from the government is to protect Saskatchewan. What a great theme. Who are you protecting? Are you protecting the CEOs, the operational leaders, which you are giving hundreds of thousands of dollars raised every year? Are you protecting us? Are we not Saskatchewan? Don't we deserve to be protected? That is all we are asking for here. We want to be treated fairly here. We are not asking for extraordinary. We know before the budget, they released the patient first care in this province. This is not something new to us. You've heard people who have worked here 20, 30 years. This is what they live every day. They get up, go to work for the patients. Exactly. It is not something new to us. If we are committed about solving the crisis of healthcare in this province, we cannot do that without the workforce. There is no way you're going to do that without the people who work for you. Yes, we appreciate the construction, the building of the urgent care facilities, the expansions in Weyburn, the expansion of Prince Albert. I can tell you folks, if you go to, there is a facility, Radville, you go there, they have a state-of-the-art equipment. You don't have people to run that equipment. If you want to fix this healthcare system, we have to think about retention. We cannot afford to let people leave this province. Our wages are the lowest in Western Canada average. This government pay healthcare workers in the past based on the Western Canada average. Alberta, Manitoba, Saskatchewan, Alberta, British Columbia. Every classifications, we are below those average. That is not sustainable. That is why people are leaving this province. And we made it very clear to them, we are not going to settle. We will not settle this time. We have settled so many times. We have received zeros, ones. We will not accept the status quo. If we are committed to fixing healthcare, we can fix the workforce. Let's work on retention. Let's give the healthcare workers the respect they need, and that will be done at the bargaining table. They can fix this healthcare crisis right now. Yep. They have the power to instruct CEHO to come to the bargaining table next week with a commitment to complete this round of bargaining. So I want to thank everyone for taking their time to be here today. We will be here if anyone has any questions, they want to know the specific. We will be here to answer those questions. But I just want to thank everyone for taking their time to come here today. Thank you all.